The crisis in Ontario's healthcare system and nursing shortages have been something that has been felt by many patients who have had to go to the hospital within the past couple of weeks, in addition to the actual staff members who are at hospitals on a day-to-day basis. The crisis has been met by the government. They have done interviews, the health minister, with some news outlets. However, the government and the Deputy Premier and Minister of Health, Sylvia Jones, did decline to come on this show, but I did speak to the NDP's healthcare critic last weekend. Joining me now for the Liberal Party's perspective is that party's interim leader, John Fraser. John, thanks so much for making the time as always, and good to have you back on the show. Let's just start out with the Ontario nursing shortages that I mentioned. How should the government be dealing with this crisis, and what would you and the Ontario Liberal Party like to see from the government on this issue?
Well, I think there's three key things. And the first thing is to repeal Bill 124. The challenge with Bill 124 is it says to nurses and other allied health care professionals, you can't bargain. You get 1%. In the same time, if you're on the police force or a firefighter, you can bargain. So it's not just about not just about the money. It's about respect. So we know that nurses are leaving at twice the rate that they normally do, twice the rate, which is not a good situation. So the government should move in quickly, repeal Bill 124, just to stabilize, to plug the hole in the boat. The second thing is foreign trained healthcare professionals. So there are tens of thousands of people who have been trained and have medical skills that would help us here, who are just sitting at home in Ontario, not able to use those skills. So the government needs to move more quickly on working with the colleges to speed up that credentialing of those people. We've got people here who can help us, but there are barriers. There are log jams that prevent people from practicing and using the skills that they learned. I think that's, when it comes down to it, I know the Premier and his minister are talking a lot about immigration. That's a good thing, right? We need more people who can come here with skills. But if we can't actually let them use those skills, the people that we have here right now, it's not going to do us much good. So, and the other piece there too, repealing Bill 124 and the relationship between healthcare workers and the province and publicly funded institutions. So who's going to want to come here and work if their pay is restricted, or if they feel that they are not valued within the system? So I think those are two really important points. And the third thing is, and you've heard me say this before, 10 paid sick days for all Ontario workers. And the reason that's important is that we want to try to slow down the transmission of the disease. One of the things is we've got people leaving their jobs, then we've got people who are absent from work because the transmission of the disease is so high. And there's some things that we can do about that. 10 paid sick days is one of them. So those are the three things that we're urging the government to do. And the fourth thing is show up. It's been 5 weeks. We haven't heard from the minister. We just sort of heard from the minister and the premier the other day. I don't think that's good enough. I don't think that's what Ontarians expect. It's a serious situation, and it needs to be dealt with in a forthright manner.
And I do want to ask you too about a new survey that was released in which it detailed that 50% of nurses are considering leaving the profession. There's about 70% of nurses who say they are not able to provide adequate care with the current resources that they have. 93% who say that their workload has increased, and 60% who say that their mental health has deteriorated. So I guess when looking at that survey in particular, what should the government be doing to provide, in this case specifically, additional mental health resources and stuff such as that to Ontario nurses?
Yeah, mental health resources are very important, especially right now after the pandemic. There's a lot of pressure and a lot of stress for all those frontline healthcare workers, nurses, and other people who are working in our hospitals and our long-term care homes. And we have to address that issue. It's very hard when these are people who care for the people who we love, the people we care for most. And they're not being able to provide adequate care to people puts a moral burden on people. So that's why we need those mental health supports. Just repeal Bill 124. It's straightforward. It's been going on for 2 years. Even healthcare organizations, executives are calling for the government to do this. because they're losing staff at such a fast rate. That's the most important thing the government can do. The premier said the other day, well, that's, we don't have to worry about that in the next round of bargaining, which is, well, that's all a year away. I don't understand. Look, it's as plain as day that Bill 124 is a barrier to an effective healthcare human resource strategy. And it's also causing not just nurses, but all sorts of healthcare workers to leave the work that they're doing and go and work in another place.
Okay, that is Ontario Liberal Interim Leader John Fraser. John, thanks so much as always for providing your insight and for speaking today on the healthcare crisis in Ontario. Appreciate it.
Good to talk to you again, Wyatt.